Hey there! If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation and Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
All right, so welcome everyone. Thank you for joining us here on Zoom, as well as those watching through the live streams on Facebook and YouTube. My name is Julia. I'm from the SIHI Secretariat, and I will be your host for tonight. And so today's session is organized in collaboration with DIMA Health, a group that focuses on enhancing access to maternal health services in Africa through digital innovation. So, like us at SIHI, they aim to foster a collaborative ecosystem for researchers, policymakers, healthcare providers, and community members. And so today we will learn more about the many great things they do, with the title of today's session being Nurturing Innovation Ecosystems. So the program is pretty straightforward. We'll have a short opening remarks and then the presentation from our guest speaker. And then afterwards, we will entertain questions and comments, but you can use the chat at any time. Just like what I see now, chats are coming in during the session. And it will also be a good opportunity for networking and sharing ideas for collaboration. So we look forward to your participation in the session. So let's get the ball rolling. To begin, may I call on Jillian from SIHI South Africa at the Bertha Center for Social Innovation and Entrepreneurship. Jillian, the floor is yours.
Thanks, Julia, and hi everyone. Good day. Thank you for joining us for today's SIHI Talks webinar featuring DIMA Health, a leader in innovative digital health solutions in Africa. I am Gillian Vidan from the Bertha Center for Social Innovation and Entrepreneurship at the University of Cape Town's Graduate School of Business. The Bertha Center embodies a commitment to reshaping how we think about and address complex social challenges. Through its thought leadership and convening, the center equips individuals and organizations to design innovative approaches to pressing problems and catalyzing meaningful change in Africa and beyond. We are thrilled to have a diverse audience with us today, all united by a shared interest in advancing healthcare and solutions that make a meaningful impact. The DIMA Health platform is committed to enhancing access to maternal health services by advancing maternal and child health outcomes in Africa through digital innovation. At DIMA Health, the objective is to facilitate collaboration and knowledge sharing, the development of innovative solutions among researchers, innovators, healthcare professionals, policymakers, and other stakeholders. We are especially excited to hear from our speaker today, Prof. Jude Igumbo, who brings his experience and vision to the discussion. Prof. Jude is an associate professor, academic coordinator of the PhD program in Public and Population Health, and he is the focal person for the Consortium of Advanced Research Training in Africa, or CARTA. Prof. Igumbo is based at the School of Public Health at my alma mater, Wits University in Johannesburg, South Africa. Once again, a warm welcome to today's SIHI Talks webinar featuring DIMA Health. We look forward to a dynamic and robust session that inspires new ideas and meaningful collaboration. Over to you, Prof.
Thanks, Julian, for the kind introduction, and also thanks to the SIHI partnership for the invitation to make our presentation about the work that we're doing under DIMA Health. It is a pleasure, indeed, an honor to be to have been invited to this group to make this presentation, given the value of the work that you do. And also, we find ourselves privileged because of the alignment that we see between the kind of work and vision that we have and what SIHI helps to achieve. So the DIMA Health project is funded by the UK government under the RISA, which is Research and Innovation Partnership Project. And under this project, we aim to create an inclusive and participatory ecosystem to reduce maternal mortality by improving overall health and well-being of mothers and babies using people-led and AI-supported solutions. The reason why we do this mostly, never mind what you all may know as the high burden of maternal mortality in Africa, which is indeed disturbing. We know, for instance, that 2 women die every minute around the world during childbirth or during pregnancy. And for this reason, we are pained by the fact that access to healthcare is still limited in many parts of the world, particularly in Africa and other developing countries. And in these places where access is limited, a number of complications that would have been avoided and deaths that could have been avoided are not being addressed as a result. We are also aware of the inconsistent public health programs whereby there are various solutions in different places where different groups feel that one solution could be more impactful than the other, and that debate, while the debate goes on, people continue to die. And also, there are also issues of lack of collaboration between the various stakeholders that are affected or necessary to address maternal mortality. And these stakeholders, as we know, often go beyond the health system to include other social determinants of health, and the communication and engagement between these various role players are not as optimal as it should be. And it's for that reason we are advancing the various solutions and a platform such as DIMA Health that seeks to contribute to reduce maternal mortality rates in sub-Saharan Africa by developing tech-enabled solutions that amplify proven innovations. So in this case, we are, first of all, we seek to create an ecosystem that brings together both innovations, that brings together communities of practice, that brings together technology to address the problem at hand. This, in our view, it becomes an ecosystem that is quite inclusive in driving innovation. And most of our work really, and as we also evolve and develop into doing this work, has really not been about creating new solutions, but rather creating technology that aims to potentiate or catalyze what is known to work. And this could be in the form of web applications, mobile applications, SMS technologies, and if necessary, call centers or hub-warm bodies who are able to bridge the gap between health systems and the underprivileged. So for all this reason, we continue to engage with our communities of practice to see how best we can collectively address the issue at hand, which is limited access to health services, documenting and catalyzing innovations, as well as empowering community through stakeholder and also stakeholder engagement. In preparing for this presentation, I found actually that most of what we do is better captured on our website, on our About Us page, where it has a list of all that we do, starting first of all with the collation of evidence, either translating research evidence from publications into tangible, actionable solutions through the use of artificial intelligence, into useful information that can be used for decision making. And that is also, we have also created it to be available in simple language, plain language that anybody really can consume in terms of finding solutions to problems. and also in multiple languages, and also in various formats that even visually, or those that are impaired in any of the senses can also consume this information. And on top of that, we try to link evidence with data from communities, whereby we have a number of, we have populated our databases with research data coming from community and other research data merged with research best practices coming from evidence, able to create it in a way that helps people to make better decisions. So that is how we are collectively using AI to drive research evidence translation by translating research, doing further data analysis, even in real time, to help make decisions that are relevant at a given time. We also have various methods of engaging various stakeholders involved in addressing the problems. This could be in the form of the forum that we've created on our platform, individual messaging systems, and similar to this webinar, we hold at least 2 webinars of experts on a monthly basis. And in most of those webinars, a number of innovations coming from industry leaders or thought leaders on the various topics are further developed into tangible solutions, most of which I'll show in a moment that the DIMA Health has developed. For instance, we hosted a group that was able to demonstrate that with text messaging and transport services linked together, we might be able to get women to health facilities faster and cut down the rate of deaths in health facilities because people are not able to get to where they should get more specialized care on time. And when that was done, that solution, though in its very rudimentary form, DIMA Health has partnered with them to develop that solution into a more sophisticated system, but also one sophisticated in terms of resourcing, so it becomes more viable to support people, but also pulling together more human and material resources on the platform to enable it to reach the most impoverished people in society. That's just one typical example of how our stakeholder engagement is helping to find innovations and develop innovation in partnership with our platform community members. I've talked about data analysis and visualization, which also helps to uncover trends, inform decisions, and also provide a system that is user-friendly in a way that anybody really can understand the data that we present. Because oftentimes the reason why the data is not used effectively in making decisions or finding innovations at work is that most of these data are quite complex to understand or not in the best form, and we make efforts to clean up data and provide in a way that people understand, not just as numbers, but also translated or interpreted in simple language that anybody really can use. And we have created a system that allow people to use this. We've created a system whereby we are able to map countries at scale, and multiple points across each country has data points that allow people in various localities to find data related to their communities and able to make better decisions related to that. And how does that also help create an ecosystem of innovation? That not only does it tell you what the problem is, it suggests solutions, but also suggests a group of people required to solve that problem, in forming partnership required to solve the problem, but also how such a problem could be resourced in an efficient way in addressing whatever the case may be. I've mentioned before that we have our mobile platform, which is the DIMA Link mobile application that has all the resources that we've created, which I'll show you in a moment, all encapsulated on this mobile app and accessible to people in their pockets, that they are able to use the research translation, data analytics, join meetings, become part of discussion forums and private messaging, all in the one digital, in the one mobile application. And in so doing, you're able to find solutions, act on solutions, connect with people in terms of creating communities around concerns and resourcing ways of addressing different problems that could be faced in any given location. What we also hoping to do is to create connection between innovators, and funders. In our first attempt at this, we created a catalog of innovations that people can use to find what works best to address various problems, as I'll show in a moment. In that same catalog, we do not only list what could work, but we also list where it could work, how it could work, and who will be required in addressing a problem, because we understand that most problems are best solved through multidisciplinary groups or multi-sectorial collaborations. And also, we also attempt to also create how to resource responding to some of these issues. In addition, community empowerment is part of what we do. An empowered community can look after itself and become more self-reliant in many ways, and may not have to depend wholly on third-party support. And for that reason, one of the innovations we've put in place is what we describe as ambassadors. These ambassadors are supposed to serve as maternal health champions, who would serve as a bridge between communities and health services and help people navigate systems when where there's a gap either in the form of communities who do not fully understand how to navigate the system, or where resources may be limited in terms of government service points. And as such, these people with a better knowledge of how the system could work could help individuals better access care. So in our approach, we seek to create a community of practice. We seek to create an informed community of practice through research evidence, as well as data analytics, using the most recent and available data in making decisions. We also create communities of practice that meet from time to time, discussing various topics, making strong resolutions, and in our own parts as technology partners, able to create necessary technology to support what is needed to address the problem. What we have discovered, why we really push a lot on the technology aspect, is that the growth in population means that a number of what we try to achieve is increasingly becoming humanly impossible. And as such, using technology when necessary to bridge this gap, or help to scale up, or catalyze, or potentiate various innovations that have been shown to work, could be a way to give more life and power to various innovations that come out of our projects. And we're also aware that there are a significant gap in access to technology, and for that reason, we take very seriously in finding a technology that works for various locations. So like I've mentioned, this could range from mobile apps to web apps to SMS, to having warm bodies to bridge the gap, and when necessary, set up call centers that could act as connection between various role players in solving problems. And just to give you an idea of some of the resources we've developed, through all this, I'm not even sure if I've been sharing my screen. Has anybody been seeing my screen? Because I've been talking through my slides.
Sorry, Prof. Julia. There are no screens. And there's
Oh my
no
goodness.
shared screen.
Oh my goodness. I've actually talked through a deck of slides. I'm sorry about that. I won't repeat it. I will just proceed to show the website. Entire screen. Pardon me. So that was what I talked about as our pain point, as our approach. And I did show our website that has some of the things I've discussed, evidence translation, stakeholder engagement, data visualization, the DIMA link, funding connections, and the ambassador program that I talked about. And moving forward back to my slides. Some of the solutions that we've created, which most of which I've talked about already, include things such as the research translation, which is really about creating actionable insight from research evidence. We have also the data analysis that's able to analyze large bodies of data across countries and be able to map this data across various locations that allow people to find where they are located and understand how to address it. Also, not considering health services indicators only, but also other social determinants of health that are outside the health facility. We've created the network of stakeholders that we convene twice every month to talk about various issues. We've also mapped health service delivery points in all the countries where we work. The three of them, Kenya, Nigeria, South Africa, and in our database, we've almost created a profile of 70,000 health facilities that not only tell you where these health facilities are located, but also many other considerations that help to improve access to health services, for making this informed decision from a management point of view, and also elements that allow climate change resilience. Private messaging we've talked about. Our system also has the DIMA Academy, has a catalog of courses that allow people to access training for free to address various deficits or gaps they could have, ranging from basic issues of respect to more advanced issues of procurement and supply chain management and executive management as well. The Safe Passage, which is a transport program, which came as a result of one of our stakeholder group meeting, where the need to create a solution to address transport barrier came up, and as a consequence, we designed a mobile application as well as SMS feature that allow people to book for transportation to receive healthcare where access may be a challenge as a result of transportation. So these are some of the things we've done, and in the interest of time, I think we still have a bit of time. Maybe I'll go to the website to demonstrate some of this. So here's our website. I did already talk about the health facilities that we have on our system. 70,000 of them, or 72,000 of them in 3 countries. And for each health facility, you're able to pick a location. And in that particular location, you are able to know where it's located, when it is open, on which days. You're able to book for services. At the end of that service, you're able to rate the health service. And if you are the owner of the health service, you're able to claim it. And claiming here allows you to manage patient booking, also allows you to respond to comments following people receiving services. Because the system also allows users to rate services that way, creating some shared leadership of health systems in such a way that those who have received care are able to, at the end of it, say, well, I've received good services, to encourage those who provided it, or to provide areas for improvement. But in our summary that is driven by artificial intelligence, for these 72,000 locations, we are able to show the strengths of the particular location, concerns that may have been raised, and recommendations on how to address the concerns raised, and an opportunity for those who manage the health facilities to also respond to the concerns raised by community and make commitments. And when this system becomes fully active, we want to be able to show progress or change over time in terms of the rating that they have. Like those who have a rating of 4, currently in the next 3 quarters, what is it going to look like? Is an increase or a decline, and what can they do about it? We also have where we've mapped countries with performance indicators because we focus on maternal and child health and maternal mortality. We look at things such as booking early, which is within under 20 weeks of pregnancy, the number of ANC visits that WHO recommends should be a minimum of 4 up to delivery, or sometimes 8, and proportion that delivered at health facilities. So for each of these locations, this is population-based, you are able to get what is really prevalent in that particular location. This data gets summarized, and recommendations are made on also how to improve if necessary. What also happens through the system from an administrative point of view is that people are able to, managers are able to eyeball or have a quick glance of poor performing areas and localize support to those areas where needed. The system, so that's for this. Something else we have, all our publications are located on this topic, are located here, where we have about 4,969 research publications on maternal and child health on a platform. And in this space, you can search for an article, and each article you open would have an interpretation in plain language and also available in multiple languages that could help make decision based on what the paper is saying. Remember, this is going to be based on a search, and it's available in these African languages as well, and you can also listen to it. In terms of innovations that could be in this particular paper, we also use AI to extract what could be innovative in this paper for further development. And all these resources are publicly available to our members of users of our platform. We have the innovation handbook, where we have 3 main concerns, which is early booking, facility delivery, frequency of visits. And for each of these, there are a number of top leading innovations that have been proven to work. And for each of them, take for instance, mobile antenatal clinics. We would describe what this innovation really looks like, where it could work, who the stakeholders are required to deliver it, the feasibility and success factors, planning consideration, project management consideration, implementation plan, cost implications of running this, sustainability challenges, mitigation plan, monitoring and continuous improvement, and so on, and an article that relates to the particular innovation. And we do this for about 38 innovations cataloged on our platform that either help to improve frequency of visits, that could help to improve facility delivery, and or early booking. So for each of these, the same kind of description and information is provided. And what else we have? We have the Academy for Training. We have the members platform where members, where members are listed, or the forums where members can have conversation on various topics, and they can also have one-on-one messaging still on the platform. Our transport program, being our flagship program, is one that's described here, but it's available on the mobile application and SMS feature as well. And in terms of so our events also, where some of these innovations come out from, are often promoted on our website, where an upcoming event is shown and discussions are had. And at the end of those events, we either create policy briefs or opinion pieces, depending. So if it is based on a research paper, we would create a policy brief. If it's based on general reviews, based on the topic and expertise of the presenter, we would create an opinion piece in responding to in response to what would have come out of the webinar. So almost every webinar that is hosted has a kind of a resolution paper that comes out of it, And most of those resolution paper will require us to act on it or to encourage others to pick up what could have been recommended. And these materials also we share on the website and also share using our mailing list that usually has major key role players on maternal and child health, and often written in very plain language and quite concise in terms of the length of the document, so one can have a quick read of this particular document. But again, if they want more detail, they can also go ahead and read the fuller article. So that's for the insights, and we also share stories on the platform. These stories could be anything from, in this case, it was about a rural woman who travels about 15 kilometers at the 8th month of pregnancy to receive antenatal care. So that already gives an idea of what we are faced with and the need for some of the innovations that we are creating. So these are some of the resources that we've created. We're hoping that would continuously bring people together, become a hub of information, and be more active in creating solutions that respond to real problems in society that's identified by role players, governments, and other partners. And the DIMA Health, as we have it, is part of a larger ecosystem that also involves many other tools we've created on multiple other platforms that seek to drive research and evidence translation. I'll pause for a moment and in the rest of my time, see if there are questions so we can have some discussion before the time runs out. I thank you, and I yield back to you, Julie.
Yes, thank you, Prof. Jude. That was a great presentation, and I'm glad that we got to see the website and as well as your slides. So I just want to react a little bit because in our times, we see that technology and going digital is really a powerful catalyst for collaboration and knowledge management, and a good way to connect what's happening on the ground or in the communities with a broader audience, like you said, the policymakers and the researchers. And it's also, going digital is also a good way to help the communities to better understand what's happening, especially through what you said, to have it in simple languages, A languages. It's really a great initiative. And I guess, at least for me, AI is something pretty new, but you have already leveraged that for research translation, which is very interesting to me. And I'm actually curious to know more about the team behind DIMA Health. So what kinds of fields or expertise collaborate to make this kind of digital platform possible? If I could start on the questions already.
So your question is, who are the users of DIMA platform or potential users of DIMA platform?
No, you guys who run it, because I get that it's a lot of health research, but the way you leveraged AI and the digital things, what kinds of fields are on your team to make this kind of ecosystem possible?
Oh, yeah. So we have a mix of skills from public health experts to IT professionals, and also other social scientists that are more familiar with social determinants of health. And for that reason, it's a very multidisciplinary team. And as we also now veer into areas of climate and health, we are also looking to collaborate with others from that space as well. So we are open to multi-sectoral collaborations and multidisciplinary teams, not just in the design and implementation, but also through every aspect of it. We are very cognizant that what drives health does not only rest in health services, but could come from outside health as well, from sanitation to finance and so on. So we are open to working with all people who contribute directly and indirectly to improving the livelihoods of women and their families.
Great, thank you. So that's on your end. So we have questions here about the who are the main users of the platform. So from Jacqueline Alger, I will read her comment. Thanks for sharing this interesting initiative. Congratulations on your successful outputs. Who are the main users of the platform at present time? Health personnel, users from the communities, or whoever they may be.
Yeah, so when we first set off to do this, the emphasis was on creating a decision support tool for health managers and healthcare providers, policymakers, funders, and so on. That was our first phase. But in our current phase, we are moving it down to the level of the patient, where we have created this cadre of community health champions who would now use the resources that we've created and the curriculum that we use to train them to help bridge the gap in health services between patients or users of health services and health services. So, and for the patients themselves, the Safe Passage program is an opportunity for them to get transportation as well. So increasingly, we are moving to support the entire ecosystem. The patients themselves in community, the providers of health services, the payers of health services, the policymakers, and so on. So it's going to become an ecosystem that brings everybody together, and everybody contributing also in shaping this to make sure that it works perfectly for everybody. For instance, in our health facility component, where we have created SMS booking for health facilities, as well as online and mobile app booking for health facilities and written health services as well as getting transportation to get there. If that's not possible, having this one body who are community champions to take people to help people access health services. So in a nutshell, it is open to anybody and everybody that are key stakeholders in maternal and child health. And what we've created, frankly, in our view and in our humility, is something that we believe can be adapted to address many other health challenges, not just maternal and child health.
All right, thank you, Prof. Jude. And I think that also answers Mr. Alex's questions of who are the members of the communities of practice drawn from, or unless you would like to add something to that.
So the communities of practice would be drawn from all of the above that I've listed. But at the present moment, because we are still in our infancy in terms of implementation, this project has been running for just about 1 year. And our current main base has been healthcare workers, policymakers, researchers, and some civil society advocates. We've not been able to tap enough into patients, but of course, most of these people are patients themselves and also use health services. So these are the people that we have been using our platform. In the last 3 months, we've hosted about 5 webinars, and those 5 webinars have attracted about 600 people and from over 30 countries. And in terms of utility of the website, we have, in the last 1 year, we have had about 6,000 engaged users who come to the website regularly from, almost all African countries and the other parts of the world as well.
Thank you, Prof. Jude. So if anyone wants to ask also a question through the mic, you can raise your hand and then I will edit the settings for you. All right. So I missed an earlier question from Mr. Turay. So are there any plans to extend this to other West African countries? And what are the basic criteria set by innovators more on hard to reach places where there is network and electricity challenges?
Yeah, so we deal with every deployment from case by case. So while we have a standard model, we're also aware that there are those limitations, and working around those limitations is what we actually set out to do and spend a lot of energy on. That can be in our current effort to zero rate our website and mobile applications so that people don't have to pay to use them, so there's no data implication. We're doing that in partnership with another group. Also, in our efforts to ensure that we offer an SMS alternative to this that is toll-free, that people are able to initiate services or receive response where they do not have internet connection or smartphones. So we are aware of this, and from time to time, work to constantly fill the gap. In terms of where there's no technology, we have created a system for identifying community health champions, provide training to them, and let them serve as our mediators in terms of offering the services that we have. And where possible, use some limited amount of resources that could be accessible to them. So it's a range of solutions, like I said, from call centers to warm bodies in communities, serving as mediators in improving access to health services.
All right, thanks, Prof. Jude. And in connection to that, to the access, Mr. Joe Tucker said here that many apps had trouble in parts of Nigeria because of loss of bandwidth. So it's a technical question. Have you considered a USSD version of the website or the mobile app?
Correct. We already have that in place. And most of the tools that we have the USSD feature. Like I said, we've been running for about a year. We keep refining that. And even the chatbot we're about to create would also follow the same route of being able to provide answers to questions based on using the USSD technology. So yes, it's something we have in the pipeline, more advanced in South Africa than other parts because of time and resources, but it's something we're working on, are very, very aware of, and constantly finding what works for different places.
Thank you, Prof. Jude. And it's great to hear that you have many different, like you said, ways to mitigate the access, like the warm bodies, the call centers, the SMS, finding what works. That's a very interesting approach. And this question from Mr. Froilan Makapil. May I know how did you educate or introduce the app to the community so they may use it properly? Was there an assessment prior to the usage of the app? Because sometimes the community is not receptive to apps or technology.
We are not heavy on the app in terms of at that level. At the level of the community, we are not heavy on the app. It's where we use mostly SMSs to either initiate services or get responses. And what we are also toiling with is working with people who are relatable with community members. These do not necessarily need to be healthcare workers, but people who seem to have been recognized and respected in communities, mostly young people who have the energy to help promote what we are doing. It's the approach that we are using. We have social media influencers that we have partnered with, and these are not your very glamorous ones that maybe scare people off, but the ones that are very relatable and very organic, very down-to-earth people that people can connect with. So the kind of criteria that we use to find people in very remote places to partner with in helping them test some of the things that we use, and talk about it in the communities where they live.
Great. And in connection to that, Mr. Froilan asked about how it's introduced to the community. For me, I'm curious is how is it introduced to the policymakers or the government, because many of your material is the policy briefs and responding to real problems in society. So has there any been partnerships or link-ups with the government or policymakers?
Yeah, so that's where so when we got our funding was it's actually supposed to end in December, this December, a month away. And we have been actively finding alternative ways of continuing to fund this. And that has caused a lot of reluctance from governments. No government wants to roll out what's going to end in a month's time. But we've kept reassuring them, and we've also been actively searching for solutions and ways to keep the project running. We're confident that that would happen because in our sustainability plan, we have built this under a bigger ecosystem of platforms such as the Africa Research Connect, which is a catalog of researchers across Africa. About 6 million of them have profiles on that particular platform. So resources from there is used to support this. So this will be going for a long time in our view. And that has been the reluctance of most governments. And but there's genuine interest from governments. There's very genuine interest from even WHO to partner with us. But their reluctance has been the sustainability of this project, whether or not it will remain running, in the near future. We hope that it will. We are working to ensure that. Other than the challenge of sustainability, there's keen interest. So I think a few governments are watching to see what will come out of it, which makes it even more difficult for us because if the earlier they begin to adopt and use, the faster we can sustain it, because that way we have the recognition and credibility to be supported by other partners. But again, it makes us more visible to begin to monetize most of our resources indirectly in a way that helps us to sustain it as well. We are constantly engaging with governments but having those meetings are not as easy as it is because they have many other competing priorities and people also presenting very similar things to them. So those are some of the challenges. But again, when we host these webinars, they're always there. That I can guarantee you. Very senior people in government coming to listen, to watch, and monitor what's going on. We've been invited by a few other countries to present to ministerial groups, and also to present to other advisory committees and working committees because of their interest in it. But I think everybody's, because it's new, it's more of a wait and see game, which is not working in our favor, but we're trying our best.
Thank you for sharing your experience on that, Prof. Jul. And I also hope that you will gain the support from the government. And I'm glad to hear that they have been supporting you and waiting for what will happen. But before that, I think Mr. Turay wants to say something, so we'll give him the floor.
Hello.
Hello.
Hi.
All right,
Yeah.
we can hear you.
Yeah, thank you very much, Professor. Though this is my first time. In the first place, I am Ray Daniel Abdul Karim, currently pursuing a master's course at Nanjing Medical University in China. I actually enjoyed the presentation more on this maternal child health. It has becoming a problem and it's an issue all over the world. I'm the one who asked the question based on how is this going to be accessible across West African countries, because my own origin of country is Sierra Leone, to be specific. I'm from Sierra Leone. I have been working with the DHMT, the District Health Management Team, for quite a long time before ever I traveled. So we have those cases in most sub-regions. We are in the district level has tried to put criteria sets on how to handle those matters, but it's still challenging. It's still challenging because one, the creation of this tool is what I'm trying to emphasize on. It's a good aspect and a good approach. Just as you said, you have been partnering with government institutions. So we hope this would be recommended and work with all duty so we can achieve this goal as one. I just want to ask more on the issue of that aim. Is it AIMA or DIMA?
DIMA.
DIMA. I want to actually know how is it going to be impacting into that particular aspect.
So what aspect is this?
The DIMA, I want to know how it is being operated.
Yeah, so DIMA Health is run by, it's led by myself. My background is in public health, epidemiology, and biostatistics. I've worked with various non-governmental organizations in providing services directly to communities and quite familiar with the health system requirements and needs. On the other side, we have the technology team that builds most of these resources. But more importantly is that we have these stakeholder groups that meet at least once a month, or in the webinars that we have one or two every month, that most of these needs are identified there, and the team goes back to address them. For instance, you've talked about the technology gaps in West Africa, the use of other alternatives to websites and mobile applications. So that is how we then go back to our teams and create solutions that address those gaps. Though we have started from our best knowledge of what the situation is, but when an issue comes up from our community of practice or from our advisory team, those tweaks are made. But more importantly, the website also has this feedback button that when users come and have challenges and issues, they can also send us messages here on what issues they're having and what they need, and we can also respond. So one is we have a group of people quite knowledgeable in their field working on it, but we're also being advised by multiple other groups in designing and implementing what we do.
Thank you very much. I appreciate for that response.
Thank you.
Okay, all right. So maybe just one last question. So what kind of training do you provide for lay people in your call centers, or maybe the community champions?
Yeah, so we have a full curriculum for training our ambassadors. So here's what the program is about, and various components of the program and how we hope to sustain it and the impact and goal we hope to get out of it. But under the academy, we have various courses on offer, on demand, ranging from quality of services to empathy and respect to management, to other courses on administration, supply chain management, cross-cutting issues in health facility administration, and so on. And this curriculum we hope to keep building based on needs that we identify either through engagement with our stakeholders or based on other needs that are coming out from research. And each of them, if you want to read more about each of the courses, you can get to see what the course really contains, who can attend, and you can contact us to give you access to receive whatever course that you could be in need of. And it's all either in-person training or access to a module platform where this training could be received. So these are some of the ways that we offer this training at the moment. In-person training in terms of the curriculums that we've created, or online training. And all of this is expected to be tracked. And at some point, we want to get to a point whereby health facilities, when members of a health facility gets training, potentially as a result of issues that they may be having in their health facility, their certification could be pasted on their pages to show that they are making efforts to change change what people may have complained about, like when they say emotional support required, staff training in a particular area, and so on, negative experiences related to discharge process. So those kind of training could be offered or curriculum created. And most of this curriculum, we also get them accredited by the university. So it's of good quality, not just for the sake of it.
Thank you so much, Prof. June, for answering all the questions. And maybe before I close the program, maybe if you would like to share your contact details, if anyone wants to connect or ask more questions, you may do so if you would like.
So yeah, so thank you very much. On our website, our contact us information is there on the DIMA website. Rishongile, if you're there, please paste our web address, and people can contact us using this information that's available on our website. Or Rishongile, also please help me to paste the DIMA Health email address and our website as well. People can contact us on the website, or just by clicking on feedback. Whatever message you drop on the feedback on the website would reach us.
All right. Thank you very much, Prof. Jude. I really learned a lot. I gained really many lessons in knowledge management, research translation, and also from your sustainability plans at DIMA Health. Amara, maybe you can also share the screen. So it's really not easy to nurture an ecosystem because there's many needs of different actors, but we saw how it can be possible through technology, meaningful programming, and strong collaboration with stakeholders. So thank you, DIMA Health, and thank you, Prof. Jude, for sharing all that with us. And thank you, audiences, for participating and sharing your time and energy with us for this session. And we hope you keep supporting SIHI and DIMA Health. So we have a short survey for the SIHI Talks that we encourage you to answer. And all previous SIHI Talks episodes are on SIHI's YouTube channel. So you can rewatch the presentation if you would like. All right. So if you'd like to know more about SIHI, please visit our webpage or any of our social media pages as you see on the screen. And we will resume in January, where members of our SIHI Hubs or SIHI Fellows will be sharing about the Social Innovation Learning Competencies Project. So once again, thank you for joining us at SIHI Talks, and we hope to connect with you all.
Thank
That
you,
ends
and
our
goodbye to
program,
all.
but yeah, thank you, Prof. Jude. We'll just leave the screen for a while. But thank you, everyone.